Thank you for coming to see me today. Due to the unusual facial sore that you have that haven't gone away in months, this could be possibly a cancerous skin cancer or just a risk factor, but nothing for sure until I can take some further tests on it. Here's a pamphlet that I have. I usually give that out to patients who may not know too much about skin cancer, but it'll tell you ways to identify it and how to treat and prevent it. Um, it'd be best to read it, but I'm going to go over some of the common skin cancers with you. One is actinic keratosis. It's a skin condition due to sun exposure. It looks scaly with red or pink colored patches on the area of the skin that was exposed to the sun. This is precancerous, so it doesn't mean you really have cancer, but if it goes untreated, you can probably increase the risk of it or possibly have cancer. Another common one is basal cell carcinoma. It's a tumor arising from the skin tissue, and it can spread locally if not treated. It appears to be pink and it looks like waxy bumps that may bleed. Melanoma is another one. It looks brown or black on the colored skin. It's brown or black on the colored skin, and it's a tumor that's malignant and arises from melanocytes, which is some pigments that are in your skin. Kaposi sarcoma, Kaposi sarcoma is a form of skin cancer that looks like a purple or brown patches on your feet. So it may not appear on anything on your body, but it'll be on your feet. And squamous cell carcinoma is a skin cancer arising from the epidermis that appears to be firm and has red bulges on your skin with scales. It grows slowly, but it's capable of metastasis in later stages. There are different types of treatments used for general skin cancer. Some treatments you can just treat it with surgery by just going right in and remove the tumor. Then we have different types of treatments that just attacks the area or kills the cancerous cells or tissues, like chemotherapy, radiation therapy, or biologic therapy. Anyone is at risk of skin cancer, but these specific factors show that you will be at a higher risk. So if you have any of these factors, or like the facial sore that you had, or any other ones, my advice would be to schedule more regular checkups in case one of these factors become cancerous. We can treat it before it gets worse. Some risk factors are having fair skin or less pigmented skin, a history of blistering sunburns, excessive sun exposure, sunny or high altitude climates, moles, family or personal history, weak immune system, radiation exposure, or exposure to certain substances such as arsenic. Some common ways to prevent the risk of cancer would be regular checkups of yourself, just looking for any unusual color discoloration or skin bumps on your body that you're not used to, besides little rashes and things like that. Also, one thing would be to wear sunscreen whenever you're outside for long periods of time, and to make sure to reapply it every 2 to 3 hours, because sometimes it does wear off. Lastly, you would want to continue to make regular checkups with your doctor to get professional checkups of your skin. Now, even though I went over some of what the pamphlet says, it's best to read it. So here you go, and you will get more in detailed information about how to treat it and more preventative methods than what I talked about. Are there any questions? No? Okay, well, let's get you scheduled for some tests.